Welcome everybody. I hope everybody can hear me. Please confirm by raising your hand in the chat box. Could you raise your hand if you can hear me? Yeah, excellent. Okay. Perfect. So could you please confirm in the chat box where you're coming from? Okay, Ahmed from Egypt. We have Ruth from Jamaica, we have GP from UK, we have from Bahrain, Jordan, Egypt, Ireland, Oman, Qatar, Kuwait, Sudan. Welcome everybody. Okay, so I'm sure everybody is very looking forward to have their online exam. As you may well know, that the RCSI has already, the Faculty of Dentistry has already had several exams, online exams. They are running the third exam the next month, okay? And as you know that there are several uncertainties about the exam. Okay, can you hear me now? I think Ahmed is having a problem with hearing me, so I think now you can hear me more properly. Okay. Yeah, okay, so there are several uncertainties. Dr. Arwa, if you're having issues hearing me, okay, I'm gonna write it because she cannot hear me. If you're having any issues hearing me, please sign out, exit, and return to the link. Okay. Okay, perfect. So I'm gonna move on to reveal some uncertainties about the MFD Part 2 online exam. If you have any questions, feel free to put them in the chat box and we'll have them answered as soon as possible. Okay, first of all, a quick introduction about myself. My name is Mohammed. I hold 2 memberships from Royal College of Surgeons of Ireland. I have 10 years of experience. Most of them were in Bahrain. I've been affiliated with the Royal College of Surgeons of Ireland, and I've been in a program in affiliation with the Royal College of Surgeons of Edinburgh. I currently work in a private practice in Bahrain. So professional degrees, of course, a BDS in 2010 from University of Baghdad, and the MFD was passed in 2015, while the MGDS, okay, some of you are asking me to keep the mic away from my mouth, and some of you are asking me to that there are hearing issues. Anyway, I'm gonna put it in the middle. So I hope now it's okay. So we have the MFD RCSI Ireland 2015. I have gained that in 2015, and the MGDS in 2017, in which I have went personally to Ireland to pass this exam. Yes, doctor, this is a recorded session, so I'm gonna, it's gonna take some time, about a couple of hours before the recording is ready on YouTube, but I'm gonna have it ready for you on YouTube in no time. So, and I'm currently planning for the fellowship. I was about to sit for the exam in June, but because of the COVID-19 situation, I could not sit for the fellowship, hopefully in the near future, once it's settled down. So I have various areas of special interest. Those who know me, I'm very interested in restorative dentistry, reconstructive dentistry to be specific, prosthodontics, and functional inclusion and TMJ, and also oral medicine and diagnosis in general, and radiographic interpretation. So moving on, I'm the founder of a group that you can find on Facebook, a Facebook page that's called Pioneer Dentist. This has been founded last year, and up to now, I have successfully given 6 courses about various Royal College exams, MJDF, MFDS, and MFD, with a passing rate of over 75%, thankfully. And so far, I have had more than about 90 colleagues, 90 dentists, over 100 recently, over 120 dentists that I have trained for Royal College exams in this year only, in the past year, from June 2019 until now, over 120 dentists. So the Royal College of Surgeons, there are, of course, 4 Royal College of Surgeons. We have the RCS England, MJDF. We have the RCS Edinburgh, MFDS. We have the RCS Glasgow, which is the sister college of Edinburgh. And we also have the RCS Ireland, which gives the MFD. Each one of them gives a different exam. Of course, you know, MJDF will no longer be available by 2021. And it's going to be replaced by its predecessor, which is MFDS. That's the original title of this degree. It's just going to simply revert back to its original form. So the COVID-19 timeline for RCS exams in 2020, so far, all exams were suspended in March 2020, of course, until September 2020. But the RCSI had a different idea, the Royal College of Surgeons of Ireland. Although they have suspended all personal exams that may predispose to the spread of COVID-19, this doesn't include online digital exams. So they came up with the idea of digital exams, and they arranged for the first exam on the 13th of June. Then they announced the MFD Part 1 exam, which is to be held in 27th of August. That's in 6 days. And the RCSI England also joined the Irish cause of having a digitalized exam. That's going to be in October. We have over 29 dentists or 30 dentists who are going to sit for this exam in October. And the Irish College will has already introduced the second online MFD Part 2 exam, in which we had many candidates succeed and pass that exam. And of course, the RCSI will give the first MFD Part 1 online exam in about 6 days. And of course, you know, we have over 30 candidates who are gonna sit for the exam in September. We wish them all luck. And of course, in October 2020, the MJDF Part 1 online exam for the first time, and the MFDS Part 1 online exam on the following day. And of course, new exams have been announced, and these include October and November 2020, this year. And we wish you all the best. So upcoming exams, this is not, upcoming exams, as you know, we have 17th of September 2020, and we have other exams in October and November 2020. Yeah. So we have other exams in October and November 2020. And the upcoming exam is on 17th of September 2020, in about 1 month. So the MFD Part 2 has changed, dramatically changed when they did this online transition. It used to be a 2-day exam with 1 day an OSCE with practical sessions, and on the following day you'd have vivas. They have canceled the vivas, and they have canceled the practical part of the exam. Now it's pretty simple. It's 15 OSCEs or clinical scenarios. Some of you might ask, would that simplify the exam? I would really doubt that. There are still uncertainties, but as a feedback from my candidates who sat for the exam in October, the OSCEs have gotten even more challenging, okay? So expect that the OSCEs would be a bit more challenging. That's because you don't have any practical sessions, you don't have any vivas. So OSCEs are basically the only way by which they can assess you. So you'd have 1 hour and 30 minutes to finish this exam. Of course, the exam subjects are 100% clinical or clinically relevant basic sciences. There will be no vivas, only 5 added OSCEs or clinical scenarios. Some of you might have frequently asked questions such as, if I got disconnected during the exam, what will happen? Will I be able to get back? Unfortunately not. So far, I haven't had any candidates, thankfully, that have been through that hideous nightmare of disconnecting during the exam, but you need to make sure that you don't get disconnected. Otherwise, your exam will be terminated and you would not get a refund. So you need to make sure that you have a proper internet connection. Who had this exam and got terminated? Dr. Ahmed is asking if someone, is there anyone who had their exam and got terminated? Oh yeah, so you know someone, okay, sorry. Yeah, and unfortunately, they would not refund you. So you need to make sure that you have a very high-speed connection in order to avoid such an unfortunate mishap. Negotiating for a reset. Well, good luck for him on that. We wish him all the best because this is really unfortunate because it's not his fault in the end. No audio, Dr. Rania. And Dr. Rania, no audio. You can turn it on. Just turn up the sound. I don't think anyone is having any issues. Dr. Kamar Al-Baba, I'm not sure if that changed recently, 20 OSCEs, but as far as I know, it's 15, right? Or there were changes recently that I am unaware of. Yeah, they are 15, not 20, okay? As far as I know as well, Dr. Ahmed, they are 15, not 20 so far, but that may change. So we need to keep a close eye on the updates from the RCSI, okay, because that may change. So how is the exam conducted? You will need a PC with webcam, a fast connection, and a smartphone. Well, heads up, here's a good news for you. Apple is gonna be launching phase 2 of the 5G connection on next month, and that's gonna really help revolutionize the way how we connect to the internet. So hopefully from September, if we had the proper access for 5G, it's gonna be a dramatic change in our connection speed and stability. So as you know, you're going to be sitting here and the table is in front of you. You're going to have a PC, a keyboard, and a screen. Laptops are acceptable, but however, tablet PCs are not acceptable. iPads are not acceptable, and tablets are not acceptable as well. Even if it was a Surface Pro, a Microsoft Surface Pro, whatever, it's not acceptable. You should have a webcam. You should have an input, a sound input, a speaker, and a microphone. And you should have a PC with a webcam. Laptop with a cam is okay. Tablet PC is not, as I mentioned. And you should also use that webcam to scan the area around you, okay? In the RCSI exam, I don't think you're gonna need a telephone. That's only for those who are gonna use the platform used by the Royal College of Surgeons of England, but not the one used by Ireland. Of course, you would need a smartphone only if you're sitting for the English exam, but not the Irish, but you need to double check because that's probably gonna change. You'd need a fast internet connection. It's better to use a cabled internet connection rather than a Wi-Fi. That's because it's going to be more stable. If you're going to use a Wi-Fi connection, you might face some technical difficulties in having a connection, and we don't want to risk that. So system requirements for PC users. So you should have a laptop or a computer, no tablets or Surface Pros, a RAM of 4 GB or more, Windows 7 or Mac 10.8 or higher. If you had your PC after 2007, you should be fine. A webcam, internet speed 1 megabyte per second or higher. But what's more important than the download is the upload speed. Cable is better than Wi-Fi router connection. Typing proficiency of 40 words per minute is recommended. Okay. So I know, don't really, please don't write on the screen. I don't really worry about the 40 words per minute. Most of my candidates who have entered the exam, they type very slowly. They barely can reach 20 words per minute. But despite this, they manage to finish. Of course, time management is very crucial. Some of them complained that time is barely enough to finish all questions. So I think that's because they have less than optimal typing proficiency. So typing speed is very important here. The faster you type, the more quickly you'd have time for revising and refining your answers, okay? So further information for the platform in which the RCSI exam is going to be held, that is TestReach. You can't hear me, but what about the others? Dr. Ishraq is having problem hearing me. Can you hear me, everybody? You can turn on your mic and answer me, or you can raise your, you can perfectly hear me, okay? The others can hear me, doctor. So if you're having issues hearing me, I'd advise you to sign out and come back again, okay? So TestReach. This is not TestReach. This is actually the one that's being used by the RCS, the RCS England. However, it's a good idea to have a look of what online exam would look like in the Royal College exams. So so we have here, they're gonna give you a link most likely, and they're gonna give you full instructions on how to access your exam. But what you should bear in mind, I couldn't find any demos about TestReach. You have to sign up for them in order to receive a demo. But what's important here is that when you enter the exam, after completing all the formalities of accessing the exam, you're gonna be seen through the webcam. Access easily from student. I'm not sure, Dr. Arwa, you need to check that, but it should be accessible. So as you can see here, you're gonna be taped through the webcam. You need to make sure that the area around you is clear and there's no obstruction. There's no obstruction. Of course, in this platform, they're gonna ask you to use your mobile phone in order to scan the area around you, but in your exam, you're gonna use your webcam to scan the area around you. You're gonna use your webcam, and how if I'm using a laptop, not sure how is that gonna work, but a webcam on a laptop is acceptable. They're not gonna ask you to use your phone as this lady is doing. Okay, and they'll ask you to bring your webcam 360 degrees around you. Just imagine that this phone is your webcam. And then they're gonna ask you to scan the area around you, and they're gonna ask you to scan your ears. Just you have to show your ears. For ladies who wear hijab, this can be problematic. So you might ask them to provide a female invigilator in that situation. okay, so as to avoid any embarrassment during the exam, okay. Um, you may use a calculator or pen and paper, but you need that's the platform here. But you need to check with them before you proceed with that. But most likely they're going to allow you to have pen and paper and uh, and the calculator to write the maximal dose of local anesthetic. For example, you need a pen and paper to write some notes. So, but I'm not sure about that. But please ask them beforehand. I have never sat for the exam, so I'm not sure about such things. But logically, they're going to allow you. I think my previous candidate said that it's okay. So exam syllabus. The exam syllabus is mostly 35% medical, which means 1/3 of the expected curriculum is going to be about medical subjects. And these what that will have to include, and these will have to include oral pathology, oral medicine, oral diagnosis in general, oral surgery, maxillofacial surgery, pharma, therapeutics, and so on. And you have the second part of the exam syllabus, which is restorative, which is 35%, which will include prostho, operative, restorative, periodontics, and so on, fixed or removable partial dentures. And you have ortho and pedo, which will have to include trauma as well. Child's dentistry in general is going to be 20% from experience. Miscellaneous subjects such as infection control, signs, and how to interpret the signs and so on, these are going to be about 10%. So how to arrange them in the new exam syllabus, which is 15 OSCEs. I suspect to have 5 OSCEs of medical subjects, and these are going to be about oral surgery, oral pathology, oral medicine, therapeutics, and medical emergencies. 5 OSCEs about restorative dentistry, 3 OSCEs about child's dentistry, and 2 OSCEs that are miscellaneous subjects. Ethics can fall into miscellaneous subjects, as Dr. Roth is stating. However, ethics is not really a very major issue that's being examined, although you need to study it. But consent issues, I don't think it's gonna show up in the exam, for example, because consent issues are very, very controversial. There are a lot of gray areas into some ethical dilemmas. But they're gonna ask you fundamentals, such as what are the 6 fundamentals of ethical practice? They're gonna ask you define negligence, etc. Yeah. So medical issues, and these are clinically oriented anatomy, oral medicine, oral pathology, oral surgery, medical emergencies, pharma and therapeutics, and medically compromised patients. Dr. Rania is asking where to study ethics, about ethics in Ireland. You don't need to study anything specifically. You just general information. They don't ask you to know all about the dental laws and ethics in Ireland. Okay, so don't worry about it too much. Okay, so restorative, the restorative part is prosto, endo, perio, and operative dentistry. That will have to include cardiology and prevention as well. As for child's dentistry, this is ortho, pedo, dental trauma. Miscellaneous subjects, infection control, laws and ethics, evidence-based dentistry, although it's not really required in the MFD exam, only something that's very simple. Professionalism, it may come up in the exam though. So this is a proposal from me about what to expect from the OSCEs when it changed into 15 OSCEs. You might expect one about anatomy. Of course, all the subjects are interrelated. So the anatomy question, you might suspect some questions about oral surgery. In prosthodontics, fixed prosthodontics, you might expect some questions about operative dentistry. Removable, you might expect something about partial dentures and complete dentures. And periodontics, you might suspect some questions about physiology or about pathophysiology of periodontal lesions, or the classification of periodontal diseases, or the perioperative interface. In endodontics, you might expect some questions interrelated with pathology and oral microbiology. Ortho and pedo, they can be very interrelated. Oral medicine and patho, of course, as well, and oral patho as well can have, an OSCE about oral pathology can have questions about oral surgery, oral medicine as well. Trauma, radiographic interpretation. Radiographic interpretation also can have other questions about endodontics or endodontic diagnosis, or other questions about oral medicine or oral patho, or even oral surgery, such as wisdom teeth extraction and so on. Okay, I'm gonna move on. Implants can have related questions about fixed prosthodontics or oral surgery, because as you know, implants has two parts, the surgical part and the restorative part as well. So bear in mind, you have 90 minutes. Time management is very crucial. You would have 6 minutes per OSCE. So for example, you'd have a clinical scenario like this one, in which you would have a 37-year-old patient who has a tenant complaining of pain from a tooth in lower right quadrant, multiple carious lesions. The patient has never experienced such a thing before and is quite confused. Why has this happened? So for a 37-year-old patient who has never had any issues with their teeth, but suddenly they had a change, such a change. So you need to know what has caused this change. Identify what has caused this change. So medical history is fit and well, recently divorced, that might be one factor. Unemployed, smokes 10 cigarettes per day. So you need to inquire about whether, for example, they might be taking any xerostomic drugs or xerostomy-inducing drugs, such as antipsychotics, which can be related to the patient's change in personal circumstances. Okay, so you have to see that coming, okay? So they might ask you, what factors might have contributed to the patient's change in oral health, such as the change in the sudden change, recent change in the patient's personal circumstances. Preventive regime, how to outline preventive regime? It's simple, you don't need to write more than 4 or 5 words in bullet points, such as diet, fluoride, change of medication, oral hygiene instructions, and so on, salivary substitutes, etc., etc. You only need to write 1 or 2 words, maximum like 4 words per each bullet point. Describe the pathology of dental caries, the layers. They might ask you about the layers of a carious lesion, or the pathophysiology of developing carious lesions. How does carious lesion develop? You'd need basically 4 basic elements, and these are a tooth, cariogenic bacteria, cariogenic food, acidogenic bacteria, and cariogenic food, but that is fermentable by these bacteria, and you would need time for caries to develop, for demineralization to take place. A clinical scenario as well, you have an anterior crossbite like this one. What would you look for? What things that you need to check for? And what will your treatment plan be? So you have to be mindful of such clinical scenarios that you can face in general practice. And for example, this one here, you have a white lesion here, and white lesion is one of the very popular themes in the exam. So describe what you see. What is your differential diagnosis? You have various differential diagnoses for a white lesion. I'm sure you'd need to know at least 5 or 6 of these. Specific information or investigations that are required apart from biopsy. What do you need to know from the patient about this that can be quite related to this lesion? And this one here, they might be given a radiograph in which there would be a lesion. And as you can see, you can note the destruction and expansion, the severe expansion here. They might ask you for a differential diagnosis list. It's impossible to gain a definitive diagnosis here unless if you have a histopathological slide of this lesion, but you can give them a list of differential diagnoses. And the most likely one, there should be one that is the most likely one. And along with the surgical management for that most likely diagnosis. And of course, you might also be given a histopathological slide like this one, in which they would ask you to describe the features in the slide. And they might ask you what's the most likely diagnosis here, and they might ask you for the management of this lesion, etc. References, what about references? You have lots of references that you can get back to for the exam. And by all means, you can find them either by PDF or you can, I prefer that you buy the original version, okay? I don't really prefer having a pirate version. So, such as Oxford Handbook for Clinical Dentistry, Applied Medicine and Surgery in Dentistry. You'd also have Oxford Handbook of Integrated Dental Biosciences. And of course, you'd have past test collection. Speaking of past tests, I'm happy that I work with these people and I write questions for them. I do editing for them. So we do share some work. So it's one of the very pleasant work experience I have ever done in my life. That's writing questions for them. So you have Master Dentistry 1, Master Dentistry 2, you have also Master Dentistry 3. You have a very long list of textbooks and references that you can get back to. FGDP standard books, they are available online for free, but not for download. They are available for browsing in the internet. Of course, of course, and you have other references such as clinical problem solving in dentistry, clinical problem solving in pedo and ortho, clinical problem solving in perio and implantology, clinical problem solving in prosto, and of course, there's also problem-based learning in endodontology. So do I need to read everything from cover to cover there? So here's the good news. No, you don't need to do that. That would be too much for you and you would not really go too deep into some issues, especially in ortho and pedo. There are a lot of things that you wouldn't need in the exam. And this book as well, and the endodontology as well, and even clinical problem solving, the general one. But you need to know what to read and what to skip, okay? So here's the thing. You might find several leaked previous questions or previous exam questions. These are very good for revision, but bear in mind that no single reference is enough for the revision of the exam. You need to make sure that your revision is systematic. Right now, the RCSI is becoming more and more unpredictable. That's what we have noticed in the past two exams. that they are getting more and more unpredictable. Their questions are getting more unpredictable. Some of them, many of them, I'm not saying most of them are not from the previous question, but many of them are things that we have never thought about. Okay, so you need to have an extensive reading, but you need to know what to read. Okay, not everything, but there are selected of many topics and things that are relevant to clinical practice. Bear in mind, relevant to clinical practice. These are the things that you need to read. So everything that is clinically applicable for general practitioners, everything that proves you are a competent dentist, everything that proves that you are patient safe. So these are things that you need to focus on. What to skip? Specialist level knowledge. They would not ask you about specialist level knowledge. Basically, the MFD and MJDF and MFDS and all these exams, what do they expect from you is that what's normally being expected from a general practitioner with 1 or 2 years of experience, postgraduate experience. That means a dentist who has just finished vocational training, as they call it in the UK. Or in some countries, they also call it internship or even rotation. So non-clinically relevant topics. Don't get lost in anatomy, pathophysiology, and biochemistry. I know many candidates who go for head and neck extensive anatomy. You don't need that. Or those who mingle too much into biochemistry or pathophysiology, no, you don't need that as well. You just get a hold of what's important in your practice. If you're still unsure, seek coaching, of course, for those who are still unsure. What we announced right now is that we are launching our 7th course. And as you know, you can get back to me anytime through my WhatsApp number. If you're required to ask any questions, my WhatsApp number is, of course, 00973. That's the country code of Bahrain. Yeah, or you can get back to me. You can write down Pioneer Dentist in the search engine in Facebook, and you'll find this page. You can just pop in and send me an inquiry. I'm going to reply anytime. If you require any information or any help, I'll be happy to answer anytime within my busy schedule, whenever I can. Okay. Even there are many people who have not signed up for my courses. When they ask for simple things, I can always reply what's required or what is needed in this situation. Or when they ask for any guidance or advice, I'll be happy to answer you as much as I can. So right now we have a course that is running for the September exam. For those of you who are sitting for September exam, who intend to attend our courses, we will give you entry, of course, for a discounted price, because for the late entry, because you have only 1 month left. Of course, all previous lectures are being recorded. You can get back to them and you can watch them. For October exam, we're gonna start on 28th of August. That's next Friday, I guess. For November 2020 exam, we're gonna start on 20 September. That's next month. However, those who are gonna sit for November are very welcome to attend with us for a refreshment with the groups in September and October. So we're gonna be able to attend to you right now, but it's gonna officially start on 20th of September. Okay, so the online course is gonna be about 2 months. It's gonna be 100% online. It's gonna be 100% in English, and there are gonna be 4 modules and 30 hours. You can, Dr. Sahar, you can register just by phoning me or sending me on WhatsApp on this number that I have mentioned previously, 009733808640, or you just pop into Pioneer Dentist and my group, my page on on Facebook, and I'm gonna answer you as soon as possible. But this is my number. My name is Dr. Muhammad Al-Sammarraie. Okay. Okay. So what do we offer? All references in a Dropbox folder, WhatsApp study group, case discussion, continuous online support, 30 hours of online teaching, focused on exam OSCEs and scenarios. All lectures will be recorded. You'll have a chance to see them later on. Access to 70 hours of lectures for our core curriculum from part 1. Access of over 50 hours of lectures of our previous MFD part 2 courses. You wouldn't need them because we're going to cover everything in the 30 hours in our study. Okay, but these are just complementary. And you will have 4 mock tests. Mock tests is going to be, normally a mock test is going to be 4 times about these 4 modules. Yeah. There's going to be a mock test about medicine and dentistry. There's going to be a mock test about child's dentistry and restorative dentistry, and a final mock. The original price was $500. Because of these times of hardship, we're offering this for $200. Okay, this is a very discounted price. It's gonna be, and it's not gonna always be there. If you come back to me next year, it's gonna change a lot because the COVID issue is gonna be resolved. But because of the COVID situation, we're offering this for a $200 fee, simple fee. Our main aim is to help you to pass this exam. And of course, it's gonna be a 30-hour course, 10 hours medical, 10 hours restorative, 6 hours orthopedo, 4 hours miscellaneous, along with mock revision. The mock tests are going to be 4, 1 for medical, 1 for restorative, 1 for child's dentistry, and a final mock for all subjects. Which days, how many days? We're gonna decide after we establish the group, which days do you prefer? But mostly we're having 2 hours in a Friday and 2 hours during the weekdays. Yeah, which means 4 hours or 5 hours per week. It's mostly 4 hours. So methods of payments, we have Western Union or any other transfer service to Bahrain. And as for the November exam, we have stated that we're going to start in September. Of course, that may change. It's according to need and demand. If you demanded an earlier start, we're going to surely have an earlier jump start for you. Okay, just have me informed before the 1st of September 2020 so I can do the necessary arrangement. So we're going to have a Q&A now. Anyone has any questions now? You can either participate by putting your questions in the chat box or by speaking through the microphone. So anyone has any questions?
Hello.
Yes, doctor.
Yeah, doctor, this is Hashim.
Yes, Dr. Hashim.
Yeah, actually my doubt is, I think the module for this, what do you call, for MFD is online course, Pioneer Dentist. I think the mock test, what you have planned in the last, might be the useful for this final exam, what I'm appearing on November. So yeah. I think, would it be better and best for me to join the course?
Yes. If you require coaching, absolutely. Not everyone requires coaching. I know many people who have passed without coaching. However, if you are unsure, and for me, as my personal experience, I wouldn't have passed the MFD, to be honest, without some orientation from someone who has experience, at least orientation. I know myself, I study a lot, but I needed that very thing that I require in an exam. That's orientation. What to focus on. I know everything, but what to focus on, that's what I need. And that's what we're here for. What to focus on in your study. Does that answer your question?
Yes, exactly. Because this time it is by luck, by chance, I can tell you that if we are registered, because as I am from India, we almost had no traveling charges and all. We don't have this mental stress and going hotels,
Yeah.
collecting exam centers and all. So I don't want to lose. I want to pass this exam.
Yeah, absolutely. So yeah, and they have reduced the exam cost dramatically. And thing is that you don't need traveling, and for our course, you don't need to uh, travel anywhere or commute anywhere. It's just gonna be done from the comfort of your own home. So that's what is fancy about online courses. Okay, so
Hello.
any other questions? Anyone who needs to ask any questions? Dr. Amara?
Yeah. What is your plan for the next year courses, or if someone wants to prepare sometime next year and he's just in a
It's
start of preparation now?
next year, you mean you're gonna sit for the exam next year?
Yeah.
Yeah, you can start preparing from now, and you can also attend our courses if you want. Um, we are not guaranteed to have courses next year. Who knows what will happen next year? But we assure you that if we open the course, we're gonna have you within that course for free, of course. Yeah. But for now, for your own preparation, it's very advisable that you start preparing for the exam as soon as possible. Yeah, because you know these are board exams. I call them board exams. They are like running a marathon. The more you read and study, the more you are well prepared, and the more is the positive outcome for the exam. Does that answer your question?
Yes.
Yeah.
Uh, Dr. Muhammad.
Yes.
Yeah, so basically, you'll be teaching us through online and through modules, and we will be having 24 hours. I mean, not 24 hours, like usual discussions on the WhatsApp
Yeah, of
regarding
course.
these.
Yeah, that we do that. Yeah, we do.
Okay.
We do continuous discussion. I answer them as soon as I can. Yeah.
So I'm sitting exam in the month of November. Okay.
Mm-hmm.
Now almost I have 2.5 months or 3 months, right?
Mm-hmm.
So it is better me to join before the September 1st, right?
Yeah, of course, absolutely.
I
You
can
can
I
join.
can join it.
You can join in now within our current groups, and then we will incorporate you with our future group on November.
And one question is that if someone joins your, online modules and, course,
Mm-hmm.
so do you have any prepared notes or something according to answer, mocks or something for the, the OSCEs and these type of stuff, which
We,
is,
of course, yeah, we're gonna give you tests, 4 mock tests, and that's how many OSCEs? That's like 60 OSCEs. Yeah,
okay.
yeah, and we will certainly discuss their answers. We're gonna have a live discussion for these, not just give you the answers. We're gonna have live discussions for these.
Okay.
Yeah, doctor. So this is not what the exam looks like, but this is my own idea about how the exam is gonna be in the new format. Okay, so just a disclaimer: this is not how the exam is gonna actually be, but this is my thought on how the exam would most likely look like. Yeah. So, any other questions?
Doctor, what is your idea behind that they will ask ethics, because it has never been asked in the exam?
Yeah, laws and ethics, they're gonna ask you basic things. If they get like negligence, what's negligence and what is, they might ask you about something basic about ethics, like the basic principles of ethics, do no harm and so on, or the it's unlikely that they'll ask you about things that are related to British, legislation, medical legal issues, such as the consent or Gillig's competence. That's highly unlikely because it's an Irish exam in the end. But if you go for MFDS Part 2, that's a different story.
Okay, thank you.
No problem. So any more questions before we sign out? In the chat box? Sorry. No problem, doctor.
Hello?
Yes, doctor.
Yes, doctor. So this your online course will be starting from September 1st, right?
Yeah, you can say that. It's gonna start from September 1st. Yeah, so you have to inform me beforehand. Yeah.
Okay.
No problem, doctor.
So Hashim, I'm Hashim.
Yeah,
Hashim Ali.
Yeah, Dr. Hashim, welcome. Dr. Ahmed, thanks for your comment. No problem. Yeah.
Thank you so much a lot.
No problem, doctors. I wish you all the best. And once again, thank you very much for coming in today. And I wish you all success and that you pass your exam from the first trial. Thank you very much for coming. And I wish you have a great day. For those who are in the Middle East, enjoy the rest of your weekend. For those west ahead, enjoy the upcoming weekend, which is gonna start tonight. Okay, so have a great day or a good evening or a good night from wherever you are right now. Thank you. Have a great day.